Both climate change and COVID-19 are public health threats. Although they are playing out on vastly different timescales, both require action to save lives, as well as adequate health systems that can provide equitable access to the most vulnerable in society. Just as with COVID-19, how well communities can cope with infectious diseases and other health impacts that are intensified by climate change ultimately depends on the underlying strength and resilience of the health system, whether it ensures protection for the most vulnerable in society, and the extent at which it protects the public health from both short and long-term health threats. Welcome, students and observers. My name is Justin Paul Zahler from MICDS High School in St. Louis, Missouri. In part 2 of the series on sustainable development titled Climate is Health, I will be examining the impact of climate change on the health of our region. Associated content and curriculum resources are produced in collaboration with the Center for Climate, Health, and Global Environment at the Harvard T.H. Chan School of Public Health. Over the past 50 years, economic, scientific, and infrastructure advancements have greatly improved the quality of human life. Unfortunately, climate change threatens to undermine most or all of these gains in public health. Losses will occur due to intensifying heat waves and extreme weather events, worsening floods and drought, altering the spread of infectious disease, and exacerbating poverty and mental ill health. Climate change presents a global public health problem, with serious health impacts predicted to manifest in various ways in different parts of the world. Public health in the United States can be affected by disruptions of physical, biological, and ecological systems, including disturbances originating in the United States and elsewhere. One such change is the prevalence and geographic distribution of food and waterborne illnesses and other infectious diseases. Warmer weather means an earlier spring, a longer mosquito season, and the expansion of mosquitoes' range beyond the tropical climates. This results in a higher risk of vector-borne illnesses such as West Nile virus and Lyme disease. Missouri's temperatures have warmed by about 0.5 to 2 degrees Fahrenheit over the last century, and projected temperature increases will usher in even more severe climate change impacts into the region. By the end of the 21st century, St. Louis is expected to experience between 15 and 50 days a year over 100 degrees. Even the lowest estimate is more than the number of extreme heat events currently experienced in El Paso, Texas, which is nearly 400 miles closer to the equator. St. Louis is particularly vulnerable because of the miles of brick buildings and lack of green spaces, which make the metro area a giant heat island. There are 3 associated health threats from extreme temperatures: exposure, air quality, and food access. In the summer of 2012, there were 21 days of record-breaking triple-digit temperatures. The city recorded 18 deaths due to heat. According to the Severe Weather Program Manager at St. Louis Health Department, as average temperatures rise, the number of deaths is also expected to increase. Other impacts due to exposure include displacement of people due to heavy precipitation events, more frequent flooding, and increased extreme heat events. Those who are most at risk of hypothermia and hyperthermia are the youngest and oldest in the population, plus people who work outside, are homeless, or live alone. Additional heat-related public health risks are likely to occur due to decreased air quality from increased ground-level ozone smog and the increased length and severity of the pollen season. Poor air quality leads to other respiratory illnesses. Finally, extreme weather can bring longer pollen season and more allergies. When droughts or floods occur, crops become more scarce and fresh fruits and vegetables are more expensive, making healthy foods more difficult to secure. St. Louis's existing inequities puts the region at higher risk. According to a 2014 report from MIT and the Oak Ridge National Laboratory, rising temperatures will short out huge swaths of the electric grid, potentially cutting off electricity and air conditioning to tens of millions of people at a time. The elderly, infants and toddlers, and people unable to afford higher electric bills will die first from heat exposure. Missouri formed a nation-leading commission in 1989 for the purpose of determining how climate change would affect the state's future, concluding its 1991 report by saying, "Our recognition of this situation provides us with the opportunity to moderate and prepare for climate change. If we fail to be accountable for our role in climate change and ozone depletion, we will pay with the diminished quality of life for ourselves and for our children." Three decades later, Missouri has not achieved its goals, and in many ways it's left the St. Louis region unprepared for the impacts of climate change and its effect on public health. In 2017, the National Association of County and City Health Officials released survey data from the health departments across the country about their competencies to do things like testing for mosquito types or controlling for mosquitoes, based on guidelines from the Centers for Disease Control and Prevention. The group found that almost no local health departments in Missouri met basic requirements, nor did the state of Missouri or the Missouri Department of Health and Senior Services have a climate action or adaptation plan. However, more activities are underway at the health department, which is primarily focused on monitoring, surveillance, and public outreach. In addition, the State Emergency Management Agency, City of St. Louis, and Jackson County have all taken steps to address climate change impacts on public health and safety. The Missouri State Medical Association has also recently passed a resolution to support and actively lobby the state legislature for comprehensive climate change policy. St. Louis is one of the 25 cities selected to participate in the American Cities Climate Challenge. As part of the challenge, St. Louis has pledged to take bold action to reduce emissions by 100% compared to the 2005 levels. Working with other cities, both in the climate challenge and around the world, St. Louis has consistently adopted methods to equitably reduce buildings' carbon impact and give residents more economic opportunity, improve air quality, and reduce greenhouse gas emissions. Crucially, the response to climate change brings immense benefits for human health with cleaner air, healthier diets, and more livable cities. The life of every child born today will be profoundly affected by climate change, facing a less certain future. Young people are taking up the mantle. Spokeswoman for Sunrise Movement in Kansas City cites Missouri's 1991 report that shows that solutions do exist. It's just a matter of urgency and action. I think by not addressing this, she says, it's a direct attack on this generation's right to dream, this generation's right to decide what they want to do with their lives as they get older. To take action or learn more about how to make an impact in the St. Louis area, links to the St. Louis chapter of the Sunrise Movement and the Missouri Coalition for the Environment can be found in the sections containing the audio and video descriptions. This podcast was produced as part of MICDS's Upper School Science Distance Learning platform in the spring term of 2020. Support for additional resources and associated content is provided through collaboration with the Center for Climate, Health, and Global Environment at the Harvard T.H. Chan School of Public Health. All associated media and cited resources for this podcast can be found in the sections containing the audio and video descriptions. From my house in St. Louis, Missouri, I'm your host, Justin Paul Zahler, science teacher at MICDS. Thank you for being with me, and stay safe.